Infections. Fever. A medical student has made some language notes on a case report. Case 45. A 20-year-old man presented with a fever which he had for 3 days. On the third day he had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever, infection with Epstein-Barr virus. At the, at the age of 18 years, he had re- returned from Africa 3 weeks previously. Fever, pyrexia, pyrexia. Also remember PUO, pyrexia of unknown origin. Fever, also known as temperature. I've got a temperature. Adjectives: feverish, feverish, febrile, febrile, and pyrexial. Opposite: afebrile, apyrexial. Some symptoms of fever: sweating, rigors, severe shivering, and sensation of coldness, also known as chills. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many non-infections, degenerative and chronic diseases. Communicability is another factor which differentiates infections from non-infectious diseases. Transmission of patho- pathogenic organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, by vaccines, especially live attenuated vaccines such as rubella vaccine, or by drug prophylaxis. For example, chloroquine, chloroquine, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Notice the common expressions of acquiring an infectious disease. Could he have caught, picked up some disease from the dog? Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, from outside. Sources, exogenous, often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organisms in the throat, for example, diphtheria, bowel salmonella, or blood hepatitis B or HIV. Non-human sources of infection include water, for example, cholera, milk, for example, tuberculosis, food, for example, botulisms, animals, for example, rabies, birds, for example, psittacosis, and also the soil, for example, Legionnaires disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Mental illness. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. These are described below. Substance abuse. Abuse of a substance means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Affective disorders. Here is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions, for example, happiness or sadness. Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expressions, facial expression or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy. Psychomotor agitation, excessive movement and thought or psychomotor retardation, slowing or of movement and thought, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. 5 or possibly 4 of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. Neurotic and stress-related disorders. An example of neurotic disorder is obsessive-compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorder. These include behavioral syndromes associated with physiological disturbance, such as eating disorders, disorders of adult personality and behavior, for example, personality disorder. Delayed mental development, schizophrenia, and other disorders in which there are delusions, false beliefs.